non-steroidal anti-inflammatory drugs from the pharmacology. Okay, the non-steroidal anti-inflammatory drugs. What is meant by non-steroidal anti-inflammatory drugs? The non-steroidal anti-inflammatory drugs which are used to reduce the inflammation, fever, and also it acts as an anesthetic effect, right? So it reduces fever, act as an anesthetic effect so that it reducing the pain. So NSAIDs, it reduces fever, reduces pain, and reduces mainly it reduces inflammation without any presence of steroid molecules. Okay, so without any presence of steroid molecules, which inhibits the inflammation, pain, and fever. Now let's come to the topic, the main topic, that is the non-steroidal drugs. Okay, so non-steroidal anti-inflammatory drugs. So I think you get done. I think you have an idea now what is NSAIDs, right? And there is this short form that you already know. N means non-steroidal and A means anti-inflammatory. For this NSAIDs, so I have abbreviated this NSAIDs to tell the mechanism and the uses and its effects, its importance. Okay, to tell this NSAIDs tells its uses, importance, and its effects. Okay, let's see. N means non-steroidal. Okay, that is without being presence of steroid molecules. And yes, which is suppresses the what it suppresses? It suppresses fever. Okay. Next, A for anti-inflammatory effect. Okay, and I stands for which is inhibition of the main action of non-steroidal anti-inflammatory drugs. Okay, that is which inhibits the COX enzymes, COX-1 and COX-2, both the enzymes. Inhibits COX-1 and COX-2. Okay, and D for decreases the prostaglandin synthesis. This is the another effect. Okay, so you'll get to know when I going to explain the mechanism of NSAIDs. So D stands for decreasing of prostaglandin synthesis, and S is suppress oil fever, whatever the effect of NSAIDs has. All those comes under suppress fever. Okay, suppress fever and suppress pain and suppress inflammation. Okay, now let's see. So I said before going to the drugs of NSAIDs, first we have to know what is COX, what is prostaglandin, right? So COX is an enzyme that is known as cyclooxygenase. Okay, that is cyclooxygenase enzyme. Okay, so if you want to know about COX in detail, so first of all you have to learn the pathophysiology. Okay, so when the tissue gets inflamed, the tissue is exposed to the inflammation. What happens? Let's see. When the tissue is inflammation, okay, the tissue is inflamed, it produces phospholipids in the cell. Okay, that phospholipids synthesize phospholipase C, not C, phospholipase enzyme. The phospholipids synthesize phospholipase enzyme. Okay. These phospholipase leads to the formation of arachidonic acid. It forms arachidonic acid. Okay. From the arachidonic acid, the COX-1 and COX-2 will be synthesized. From which pathway? Arachidonic has involved in the two pathways. One is cyclooxygenase pathway and the other one is lipoxygenase pathway. Yes, the arachidonic acid involved in two pathways, that is cyclooxygenase pathway and lipoxygenase pathway. The cyclooxygenase pathway. In the cyclooxygenase pathway, it produces COX-1 and COX-2 enzymes. Okay, COX-1 and COX-2 enzymes. Okay, COX-1 and COX-2. These both the enzymes are secreted by the cyclooxygenase pathway of arachidonic acid. Okay, what will happen next after the secretion of this enzyme? The cyclooxygenase pathway leads to the formation of, okay, here I will write the both the enzymes from the cyclooxygenase pathway. It secretes the prostaglandin G₂. Prostaglandin G₂. Okay, and in presence of peroxidase enzyme. In presence of peroxidase enzyme. In presence of peroxidase enzyme, the prostaglandin G₂ is synthesized PGH₂. Okay, the PGH₂ will be formed. What is PGH₂? Again, a prostaglandin H₂. PGH₂ is a prostaglandin H₂. The prostaglandin H₂ is a precursor for formation of many substances. It acts as a precursor. From this PGH₂, it leads to formation of many substances such as in presence of prostaglandin E synthase. Okay, in presence of prostaglandin E synthase, it leads to formation of prostaglandin E₂. Next substance. In presence of prostacyclin synthase, the presence of prostacyclin synthase is to formation of PGI₂, that is prostacyclin synthase. In presence of thromboxane synthase, it leads to formation of thromboxane A₂. Okay, and there are left with other two compounds. So what are they? The next one is in presence of PGF₂. Okay, PGF₂ synthase. In presence of PGF₂ synthase, it leads to formation of PGF₂ alpha. And the next one is in presence of PGD₂. Okay, PGD synthesis. In presence of PGD synthase, it leads to formation of PGD₂. Okay, so these are the compounds which are formed by the precursor of PGH₂. So I said about the formation of all these compounds, from where they are, all those compounds are forming from the cyclooxygenase pathway. From the cyclooxygenase pathway, it leads to formation of COX-1 and COX-2, and this COX-2 leads to the production of the prostaglandin synthesis. Different types of prostaglandin synthesis. From the PGH₂, first it leads to formation of PGH₂, and in presence of peroxidase formed into PGH₂, and the next from the PGH₂ it leads to formation of PGE₂ in presence of prostaglandin synthesis, and PGI₂ in presence of prostacyclin synthesis, thromboxane in presence of thromboxane synthesis, and also PGF₂ alpha in presence of PGF synthase. Okay, and PGD₂ in presence of PGD synthesis. What is this alphabets? What is this? They are prostaglandin synthesis, but they are differentiated by the alphabets and the numbers. So what it indicates? The numbers indicates the number of double bonds. Okay, the number of double bonds present in this substance. Okay, for example PGD₂. Okay, what is indicates? So there are double bonds. How many double bonds? 2 double bonds are present in the PGD₂. The number indicates only presence of double bonds. And the alphabet, this D, A, I, all this indicates. Okay, all this indicates there is a functional groups. Those functional groups are different, but all are prostaglandins. All are belong to the class of prostaglandin, but the only difference is functional group. So to differentiate the structures, to differentiate these compounds, these substances, they gave alphabets and the numbers. This is not important for you. I'm just explaining, so you will get confused what are these numbers and what are these alphabets. So just I'm giving a clarification. Okay, yes. So after the formation of these enzymes, these compounds, substances, whatever it may be, so what are their functions? What is the use of it? How it is involved when the tissue get inflamed? When the tissue is inflammation, okay, when the tissue is undergone inflammation, so first it produces from the cyclooxygenase pathway COX-1, COX-2 enzymes, and you know whatever will happen in this pathway, right? And what are the functions? When the COX-1, COX-2, okay, it leads to formation of these substances. Let's go one by one individual about these structural and functional variations, not structural, the functional variations of the substances. Okay, PGE₂. The PGE₂ is produces pain, fever, and when the tissue is inflamed, it leads to production of pain, fever, and also inflammation. Inflammation is main here, okay, and protects gastric mucosa, which protects gastric mucosa. And which increases the renal blood flow. Okay, and the prostacyclin and the thromboxane both are involved in the platelet aggregation. Okay, the PGF2 alpha. The PGF2 alpha is involved in the bronchoconstriction. Okay, it involves in bronchoconstriction and also involved in smooth muscle contraction. Okay, and the last substance which is found by the PGH2, prostaglandin H₂, which is PGD₂, right? This PGD₂. What are the functions of PGD₂? It involves in the allergic reactions. So it produces allergic type reactions. And also bronchoconstriction. Okay, so these are the effects when the